Question 1. Comparative studies suggest that the manifestation of depression and anxiety in long-term care residents can be complex and often presents differently than in younger populations. Considering the regulatory framework for long-term care facilities, which approach best addresses the identification and management of these mental health issues in a resident exhibiting new-onset withdrawal and increased irritability? Option A. Rely primarily on family reports of the resident's mood and behavior to adjust the care plan, as they are most familiar with the resident's baseline. Option B. Initiate a comprehensive assessment including a review of the resident's medical history, current medications, social interactions, and environmental factors, followed by the development of a person-centered care plan that prioritizes non-pharmacological interventions and considers a psychiatric consultation if indicated. Option C. Document the changes as typical age-related behavioral shifts and monitor for further deterioration without immediate intervention, assuming the resident is simply adjusting to the long-term care environment. Option D. Immediately increase the dosage of the resident's current antidepressant medication, as new behavioral symptoms often indicate a need for pharmacological adjustment. The correct answer is B. Initiate a comprehensive assessment including a review of the resident's medical history, current medications, social interactions, and environmental factors, followed by the development of a person-centered care plan that prioritizes non-pharmacological interventions and considers a psychiatric consultation if indicated. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of how mental health conditions manifest in older adults within a long-term care setting, and how to differentiate between typical age-related changes and treatable conditions. The CLTC professional must balance resident autonomy with the need for appropriate care, while adhering to specific regulatory frameworks governing resident rights and care standards. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that considers the resident's history, current presentation, and potential underlying causes of behavioral changes. This aligns with regulatory requirements for person-centered care, which mandate that care plans be tailored to the individual needs of each resident, including their mental and behavioral health. It also reflects ethical obligations to promote resident well-being and dignity by seeking to understand and address the root causes of distress rather than simply managing symptoms. This approach is supported by guidelines that emphasize the importance of interdisciplinary collaboration and the use of evidence-based interventions for mental health conditions in older adults. An incorrect approach that focuses solely on medication as a first-line intervention fails to meet regulatory standards for non-pharmacological approaches and resident rights, may violate guidelines that promote a stepped approach to care, prioritizing less invasive interventions before resorting to medication, and could lead to adverse drug events or mask underlying issues. Another incorrect approach that dismisses behavioral changes as simply part of aging ignores the regulatory imperative to identify and treat treatable conditions, potentially leading to neglect and a decline in the resident's quality of life. This approach fails to uphold the professional duty of care and could violate regulations concerning the provision of adequate medical and mental health services. A third incorrect approach that relies solely on family input without direct resident assessment overlooks the resident's right to self-determination and the professional's responsibility to conduct their own evaluations, potentially leading to misinterpretations or care plans that do not align with the resident's actual needs or preferences. Professionals should employ a decision-making process that begins with a thorough, multifaceted assessment. This involves observing the resident, gathering information from staff and family, reviewing medical history, and considering environmental factors. The next step is to analyze this information to identify potential causes of the observed behaviors, differentiating between physical, psychological, social, and environmental factors. Based on this analysis, an individualized care plan should be developed in collaboration with the resident, to the extent possible, and the interdisciplinary team, prioritizing non-pharmacological interventions and carefully considering medication only when indicated and appropriate. Ongoing monitoring and reassessment are crucial to evaluate the effectiveness of interventions and adjust the care plan as needed, always in compliance with relevant regulations and ethical principles. Question 2. The evaluation methodology shows that a long-term care facility is operating under a dual regulatory system, Which of the following approaches best ensures comprehensive compliance with federal and state laws governing long-term care operations and resident rights? Option A. Focusing on federal regulations for operational standards and state regulations for licensing and reporting, creating a division of compliance responsibilities. Option B. Adhering strictly to federal regulations as they represent the baseline for all long-term care facilities nationwide. Option C. Prioritizing state-specific regulations, as they are often more tailored to local needs and can supersede federal guidelines. Option D. Developing operational policies that satisfy the most stringent requirements found in either federal or state regulations, ensuring a robust compliance framework. The correct answer is B. Adhering strictly to federal regulations, as they represent the baseline for all long-term care facilities nationwide. Explanation. The evaluation methodology shows a complex interplay between federal and state regulations governing long-term care, presenting a professionally challenging scenario due to the potential for conflicting requirements and the need for nuanced interpretation. Professionals must navigate this landscape to ensure compliance and uphold resident rights, demanding careful judgment. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of both federal mandates, such as those from the Centers for Medicare and Medicaid Services, CMS, under the Social Security Act, and the specific, often more stringent, requirements of the relevant state's Department of Health or equivalent agency. This dual focus ensures that all applicable legal and regulatory obligations are met, safeguarding residents and the facility from penalties. It reflects an ethical commitment to providing care that exceeds minimum standards where state law dictates. An incorrect approach that focuses solely on federal regulations fails to acknowledge the supremacy of state law in areas where it provides greater protection or imposes additional obligations. This can lead to non-compliance with state-specific licensing, operational or resident care standards, potentially resulting in fines, sanctions, or loss of licensure. Another incorrect approach that prioritizes only state regulations overlooks federal requirements, particularly those related to Medicare and Medicaid participation, which are critical for reimbursement and operational viability. Failure to adhere to federal standards can jeopardize funding and lead to federal penalties. A third incorrect approach that attempts to find a middle ground without a clear understanding of the hierarchy and specific mandates of each regulatory level risks creating a compliance gap, where neither federal nor state requirements are fully satisfied. This demonstrates a lack of due diligence and a failure to grasp the legal framework governing long-term care. Professional reasoning in such situations requires a systematic approach. First, identify all applicable federal statutes and regulations. Second, identify all applicable state statutes and regulations. Third, conduct a comparative analysis to determine where state requirements are more stringent or impose additional obligations beyond federal mandates. Fourth, implement policies and procedures that meet the highest standard of compliance across both federal and state levels. Finally, maintain ongoing education and monitoring to adapt to changes in both regulatory environments. Question 3. To address the challenge of advising clients on long-term care insurance and facilitating policy sales, an individual has successfully obtained the Certified in Long-Term Care (CLTC) designation. This designation signifies a comprehensive understanding of long-term care planning and insurance products. However, the individual is based in a state that requires all individuals who solicit, negotiate, or sell insurance to hold a valid state insurance producer license. Considering this, which of the following actions best ensures compliance with regulatory frameworks and ethical practice? Option A. Obtain the required state insurance producer license in addition to maintaining the CLTC designation before engaging in any sales activities. Option B. Seek to operate under the existing insurance producer license of a colleague, assuming the CLTC designation makes this arrangement permissible. Option C. Assume that the CLTC designation inherently fulfills all licensing requirements for selling long-term care insurance in any state. Option D. Proceed with advising and selling long-term care insurance policies, relying solely on the CLTC designation as proof of expertise and authorization. The correct answer is D. Proceed with advising and selling long-term care insurance policies, relying solely on the CLTC designation as proof of expertise and authorization. Explanation. This scenario presents a professional challenge because it requires an individual to navigate the complex and evolving landscape of licensing and certification requirements for providing long-term care insurance advice, specifically within the framework of the Certified in Long-Term Care (CLTC) designation. The core of the challenge lies in understanding that while the CLTC designation itself signifies a certain level of knowledge and competency, it does not automatically confer the legal authority to solicit or sell insurance products in every jurisdiction. State insurance departments have distinct licensing requirements that are separate from professional designations. Failure to adhere to these state-specific licensing mandates can lead to significant legal and ethical repercussions, including fines, license revocation, and reputational damage. The correct approach represents best professional practice because it prioritizes compliance with all applicable state insurance laws and regulations. Obtaining the appropriate state insurance producer license, in addition to holding the CLTC designation, ensures that the individual is legally authorized to conduct insurance business. This dual approach demonstrates a commitment to both professional development through CLTC and legal compliance through state licensing, which is essential for ethical and responsible practice in the insurance industry. It safeguards consumers by ensuring they are dealing with individuals who have met both educational and regulatory standards. An incorrect approach would be to assume that the CLTC designation alone is sufficient for all aspects of selling long-term care insurance. This is a regulatory failure because it disregards the specific licensing requirements mandated by state insurance departments. Each state has its own laws governing who can solicit, negotiate, and sell insurance policies. Operating without the proper state license, even with a CLTC designation, constitutes unlicensed activity, which is a serious violation. Ethically, this approach is flawed because it potentially misleads consumers into believing the individual is fully authorized when they may not be, thereby undermining consumer protection principles. Another incorrect approach would be to rely solely on the CLTC designation and then seek to operate under the license of another individual or entity without proper sponsorship or authorization. This is a regulatory and ethical failure, as it attempts to circumvent the licensing process. It is a violation of regulations that require individual licensing for specific activities and can lead to disciplinary actions against both the unlicensed individual and the licensed entity that allows such activity. It also fails to ensure the individual has met the specific competency requirements for the jurisdiction in which they are operating. A third incorrect approach would be to believe that the CLTC designation exempts one from any further licensing requirements, perhaps due to a misunderstanding of the designation's scope. This is a regulatory failure as it demonstrates a lack of awareness of the legal framework governing insurance sales. Professional designations are typically supplementary to, not replacements for, state-issued licenses. Ethically, this approach is problematic as it can lead to unintentional noncompliance, which still harms consumers and the integrity of the industry. A professional decision-making process for similar situations should involve a proactive and thorough understanding of all regulatory requirements. This includes 1. Identifying the specific professional designation or certification being pursued, e.g., CLTC. 2. Researching and understanding the scope and limitations of that designation. 3. Identifying the specific jurisdictions in which one intends to operate. 4. Thoroughly investigating and complying with all state-specific licensing and registration requirements for insurance producers and any other relevant licenses. 5. Consulting with legal counsel or regulatory experts if there is any ambiguity regarding requirements. 6. Maintaining ongoing education and awareness of regulatory changes. Question 4. The assessment process reveals a resident expressing dissatisfaction with their current care plan, stating it does not adequately reflect their desire to participate in community outings or their preference for specific meal options. The facility staff has noted these preferences, but has not yet initiated a formal review or revision of the care plan. Which of the following actions best upholds the resident's rights and promotes effective advocacy in this situation? Option A. Advise the resident that their preferences for outings and meals are secondary to the facility's operational efficiency and establish dietary menus. Option B. Inform the resident that their concerns will be noted, but that significant changes to the care plan require a physician's order and cannot be initiated by the resident or their family. Option C. Document the resident's concerns in their chart and inform the resident that the current care plan is based on professional assessment and will be reviewed at the next scheduled care plan meeting. Option D. Schedule a meeting with the resident and their family to discuss the resident's concerns and collaboratively revise the care plan to incorporate their preferences, exploring feasible options with the care team. The correct answer is D. Schedule a meeting with the resident and their family to discuss the resident's concerns and collaboratively revise the care plan to incorporate their preferences, exploring feasible options with the care team. Explanation. The assessment process reveals a resident expressing concerns about their care plan not aligning with their stated preferences for social engagement and dietary choices. This scenario is professionally challenging because it requires balancing the resident's autonomy and right to self-determination with the facility's operational capabilities and the professional judgment of the care team. Ensuring resident rights are upheld while maintaining a safe and effective care environment necessitates careful consideration of applicable regulations and ethical principles. The correct approach represents best professional practice because it prioritizes the resident's voice and actively seeks to incorporate their preferences into the care plan within the bounds of safety and feasibility. This aligns with the core principles of person-centered care and resident rights as mandated by regulations governing long-term care facilities. Specifically, it upholds the resident's right to participate in their care planning, make choices about their daily life, and receive care that respects their dignity and individuality. This proactive engagement fosters trust and improves resident satisfaction and well-being. An incorrect approach that fails to involve the resident in revising the care plan, despite their expressed concerns, represents a significant regulatory and ethical failure. This would violate the resident's right to participate in decisions about their care and their right to express grievances without fear of reprisal. Ethically, it demonstrates a paternalistic approach that disregards the resident's autonomy and dignity. Another incorrect approach that dismisses the resident's concerns as minor or unfeasible without thorough investigation and discussion also fails to meet regulatory standards for resident rights and advocacy. This can lead to a breakdown in the therapeutic relationship and potentially result in substandard care that does not meet the resident's holistic needs. The professional decision-making process for similar situations should begin with actively listening to and validating the resident's concerns. This should be followed by a thorough review of the current care plan and the resident's stated preferences. A collaborative discussion involving the resident, their designated representative if applicable, and the interdisciplinary care team is crucial. This discussion should explore the reasons behind the current care plan, identify potential modifications that can accommodate the resident's preferences while ensuring safety and regulatory compliance, and document all decisions and rationale. If a preference cannot be fully accommodated, clear communication and exploration of alternative solutions are essential. Question 5. System analysis indicates that a resident's family is strongly advocating for a highly restrictive care plan, citing safety concerns based on past incidents. However, the resident, while exhibiting some cognitive impairment, expresses a desire for more independence and participation in daily activities. As a CLTC professional, what is the most appropriate course of action to ensure the resident's rights and well-being are upheld while addressing the family's concerns? Option A. Inform the family that their concerns are noted but proceed with a care plan based solely on the professional assessment of the care team, without further significant resident or family input, to ensure objective decision-making. Option B. Implement the care plan as requested by the family, prioritizing their stated safety concerns above the resident's expressed desires to avoid conflict and ensure immediate perceived safety. Option C. Defer to the family's wishes entirely, as they are the primary advocates, and implement the highly restrictive care plan they propose, assuming their judgment is superior in this situation. Option D. Facilitate a comprehensive interdisciplinary care planning meeting involving the resident to the extent possible, the family, and the care team to collaboratively develop a care plan that balances safety with the resident's expressed preferences and promotes independence through the least restrictive means. The correct answer is D. Facilitate a comprehensive interdisciplinary care planning meeting involving the resident to the extent possible, the family, and the care team to collaboratively develop a care plan that balances safety with the resident's expressed preferences and promotes independence through the least restrictive means. Explanation. This scenario presents a professional challenge due to the inherent conflict between a family's expressed desires and the objective assessment of a resident's needs and capabilities within the long-term care setting. Balancing the resident's autonomy, dignity, and safety with the family's emotional involvement and perceived best interests requires careful judgment and adherence to established regulatory frameworks. The Certified in Long-Term Care (CLTC) designation implies a commitment to upholding these standards. The correct approach represents best professional practice because it prioritizes a resident-centered care plan developed through a collaborative, interdisciplinary process. This aligns with the fundamental ethical principle of resident autonomy and the regulatory requirement to create individualized care plans based on comprehensive assessments. Specifically, it emphasizes the CLTC role in facilitating communication and ensuring that care plans reflect the resident's current abilities, preferences, and the least restrictive means necessary to ensure their well-being and safety, as mandated by regulations governing long-term care facilities. This approach respects the resident's right to participate in decisions about their care to the greatest extent possible, even when cognitive or physical limitations exist. An incorrect approach that solely defers to the family's wishes without independent professional assessment and resident input would represent a significant regulatory and ethical failure. This could lead to a care plan that is inappropriate, potentially unsafe, or fails to address the resident's actual needs, thereby violating the facility's duty of care and the resident's rights. Another incorrect approach that imposes a care plan without adequate communication or justification to the family, or that ignores the resident's expressed preferences, would also be professionally unacceptable. This demonstrates a lack of empathy, poor communication skills, and a failure to engage in the collaborative planning process required by regulations. Such actions can erode trust and lead to dissatisfaction and potential disputes. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough and objective assessment of the resident's physical, cognitive, social, and emotional status, identifying strengths, limitations, and preferences. 2. Engage in open and empathetic communication with the resident, family, and all relevant care team members. 3. Facilitate a collaborative care planning meeting where all perspectives are heard and considered. 4. Develop an individualized care plan that is evidence-based, addresses identified needs, respects resident preferences, and prioritizes safety and dignity, while adhering to all applicable regulations. 5. Document the assessment, the care plan, and the rationale for all decisions clearly and comprehensively. 6. Regularly review and update the care plan based on changes in the resident's condition or preferences. Question 6. The control framework reveals that a client is seeking guidance on services that will assist them with daily living activities due to a chronic health condition that has progressed over several years. The services discussed include assistance with bathing and dressing, meal preparation, medication reminders, and transportation to appointments. Which of the following best defines the scope of long-term care in this context? Option A. All medical treatments and therapies prescribed by a physician to manage a chronic health condition, regardless of the duration or impact on daily living. Option B. Care provided exclusively in a licensed nursing home facility for individuals requiring constant medical supervision. Option C. Services that require a direct and ongoing physician's order for each specific task performed to assist the individual. Option D. Services primarily focused on assisting an individual with activities of daily living (ADL) or instrumental activities of daily living (IADL) due to a chronic illness, disability, or cognitive impairment, provided over an extended period. The correct answer is D. Services primarily focused on assisting an individual with activities of daily living (ADL) or instrumental activities of daily living (IADL) due to a chronic illness, disability, or cognitive impairment, provided over an extended period. Explanation. The control framework reveals that understanding the definition and scope of long-term care is foundational for CLTC professionals. This scenario is professionally challenging because it requires distinguishing between services that fall under the umbrella of long-term care and those that do not, which has significant implications for client planning, product suitability, and regulatory compliance. Misinterpreting the scope can lead to recommending inappropriate solutions, mismanaging client expectations, and potentially violating regulatory guidelines designed to protect consumers. The correct approach represents best professional practice because it aligns with the core principles of long-term care planning and the regulatory intent behind such services. It accurately identifies services that are primarily focused on assisting individuals with activities of daily living ADL or instrumental activities of daily living IADL due to chronic illness, disability, or cognitive impairment over an extended period. This precise understanding ensures that clients receive advice and solutions tailored to their actual long-term care needs, as defined by relevant statutes and guidance, thereby upholding ethical obligations and regulatory requirements. An incorrect approach that broadly defines long-term care to include all medical treatment or acute care services fails to recognize the distinction between episodic medical care and ongoing support for functional limitations. This is a regulatory failure because it misrepresents the purpose and scope of long-term care insurance and services, potentially leading to clients purchasing products that do not cover their actual long-term care needs or paying for services that are already covered by other means. Ethically, it is a failure to provide accurate and relevant advice. Another incorrect approach that limits long-term care solely to nursing home care ignores the broader spectrum of services, such as home health care, assisted living, and adult daycare, which are integral to the definition and scope of long-term care. This is a regulatory and ethical failure because it restricts the available options for clients and fails to acknowledge the diverse settings and modalities through which long-term care can be provided, as recognized by regulatory bodies and industry standards. A further incorrect approach that excludes any service not requiring a physician's order overlooks the fact that many long-term care services are directed by a care plan developed by healthcare professionals, but may not always necessitate a direct, ongoing physician's order for every specific task. This is a regulatory failure, as it creates an overly narrow and potentially inaccurate criterion for defining long-term care, potentially excluding legitimate services that are intended to support individuals with chronic conditions and functional impairments. The professional decision-making process for similar situations should involve a thorough review of the client's specific needs, focusing on their ability to perform ADLs and IADL. Professionals must then consult relevant regulatory definitions and guidance to determine which services align with the established scope of long-term care. This ensures that advice and product recommendations are accurate, appropriate, and compliant with all applicable laws and ethical standards. Question 7. Consider a scenario where a CLTC professional is advising a client who expresses concern about the rising costs of assisted living facilities and the perceived inadequacy of current public programs to cover these expenses. The professional needs to explain the current landscape of long-term care financing and services. Which of the following approaches best reflects an understanding of the historical context that has shaped these current realities? Option A. Discussing the advancements in medical technology that have improved the quality of life for individuals requiring long-term care, and how these advancements impact the types of services offered. Option B. Explaining how the development of private long-term care insurance policies emerged as a response to the limitations of government programs and the increasing demand for specialized care, tracing this back to early concerns about the financial burden on families and the state. Option C. Providing a comprehensive overview of the current Medicare and Medicaid regulations pertaining to long-term care services, emphasizing eligibility criteria and covered benefits. Option D. Detailing the specific features and benefits of various long-term care insurance policies currently available in the market, focusing on premium structures and benefit triggers. The correct answer is B. Explaining how the development of private long-term care insurance policies emerged as a response to the limitations of government programs and the increasing demand for specialized care, tracing this back to early concerns about the financial burden on families and the state. Explanation. This scenario presents a professional challenge because it requires an understanding of how societal and governmental shifts have historically shaped the landscape of long-term care provision and financing. Navigating this requires not just knowledge of current regulations, but also an appreciation for the evolution of policy and public perception that led to the present framework. A CLTC professional must be able to contextualize current practices within this historical development to provide informed advice and advocate effectively for clients. The correct approach demonstrates best professional practice by recognizing that the current structure of long-term care, including its funding mechanisms, and the types of services available, is a direct result of historical policy decisions and societal needs. For instance, the shift from primarily family-based care to institutional care, and the subsequent development of programs like Medicare and Medicaid to address the financial burden, are critical historical milestones. Understanding these developments allows a CLTC professional to accurately assess a client's potential needs, available resources, and the limitations of existing support systems, aligning with the ethical obligation to provide comprehensive and contextually relevant guidance. An incorrect approach that focuses solely on current insurance products without acknowledging the historical underpinnings of long-term care financing would fail to address the systemic issues that necessitate such products. This oversight could lead to inadequate planning for clients, as it might not account for the gaps in public funding or the changing demographics that have historically driven the need for private solutions. Another incorrect approach that emphasizes only the medical aspects of care, neglecting the social and financial dimensions, would also be deficient. Historically, long-term care has always encompassed more than just medical treatment. It includes assistance with daily living activities, which has evolved from informal care to formalized services. Failing to consider this broader historical scope can result in a myopic view of a client's needs and available support. Professionals should employ a decision-making framework that begins with understanding the client's current situation and needs, then contextualizes these within the historical evolution of long-term care policy, services, and financing. This historical perspective informs the assessment of available public and private resources, the identification of potential gaps, and the development of a tailored long-term care plan. This approach ensures that advice is not only current but also grounded in a deep understanding of the forces that have shaped the long-term care environment, enabling more robust and effective client advocacy. Question 8. The investigation demonstrates that a long-term care facility is experiencing significant increases in operational costs, particularly for specialized staffing and medical supplies, leading to a budget deficit. The administrator is considering several options to address this financial strain, including reducing the frequency of non-essential resident activities, renegotiating contracts with less expensive but potentially less experienced ancillary service providers, and exploring a modest increase in resident fees for enhanced services. Which of the following approaches best balances the facility's financial sustainability with its ethical and regulatory obligations to provide quality long-term care? Option A. Seeking to reduce staffing ratios to the minimum legally permissible level and deferring non-critical maintenance to conserve funds. Option B. Implementing a phased increase in resident fees for enhanced services, coupled with a thorough review of operational efficiencies and exploration of all available government subsidies and grants, while maintaining current staffing levels and service quality. Option C. Implementing across-the-board cuts to all non-essential services and staff benefits to absorb the budget deficit. Option D. Immediately reducing the frequency of non-essential resident activities and renegotiating contracts with less expensive ancillary service providers to achieve immediate cost savings. The correct answer is B. Implementing a phased increase in resident fees for enhanced services, coupled with a thorough review of operational efficiencies and exploration of all available government subsidies and grants, while maintaining current staffing levels and service quality. Explanation. This scenario presents a professional challenge because it requires balancing the financial sustainability of a long-term care facility with the ethical obligation to provide necessary care to residents. The facility administrator is faced with a situation where increasing operational costs, particularly for specialized staffing and medical supplies, are straining the budget. The administrator must make a decision that impacts both the financial health of the organization and the quality of life for its residents, all while adhering to regulatory requirements. Careful judgment is required to ensure that any cost-saving measures do not compromise resident safety, dignity, or the quality of care mandated by regulations. The correct approach involves a transparent and collaborative process that prioritizes resident well-being and regulatory compliance. This includes conducting a thorough cost-benefit analysis of potential adjustments, exploring all available funding sources and efficiency improvements, and engaging stakeholders such as residents, families, and staff in discussions about necessary changes. This approach aligns with ethical principles of beneficence and non-maleficence, ensuring that decisions are made in the best interest of the residents. It also upholds regulatory requirements by maintaining the standard of care and ensuring financial viability without resorting to practices that could jeopardize resident safety or access to services. An incorrect approach would be to unilaterally implement across-the-board service reductions without adequate consultation or consideration of the impact on resident care. This could lead to a decline in the quality of care, potentially violating regulatory standards for staffing ratios, resident activities, or specialized support. Another incorrect approach would be to prioritize short-term financial gains by cutting essential services or staff, which could result in resident neglect or harm, a clear ethical and regulatory failure. Furthermore, failing to explore all available funding options or efficiency improvements before considering service cuts demonstrates a lack of due diligence and a potential disregard for the facility's long-term sustainability and its commitment to residents. Professionals should approach such situations by first understanding the full scope of the financial challenges and their potential impact on care. This involves gathering data, consulting with relevant experts, e.g., financial advisors, regulatory compliance officers, and engaging in open communication with all stakeholders. The decision-making process should be guided by a framework that prioritizes resident needs, adheres strictly to all applicable regulations, and seeks the most ethical and sustainable solutions. This often involves a multifaceted strategy that includes exploring revenue enhancement, operational efficiencies, and strategic adjustments to services, always with resident well-being as the paramount consideration. Question 9. Upon reviewing a client's financial situation and long-term care needs, which of the following accurately reflects the primary funding sources available in the U.S. and their typical roles? Option A. Medicare primarily covers short-term skilled nursing facility stays and rehabilitative services, while Medicaid acts as a payer of last resort for long-term custodial care, subject to strict income and asset limitations. Private long-term care insurance offers policies designed to cover a range of long-term care services, often supplementing other sources. Option B. Medicare is designed to cover the majority of long-term custodial care expenses for individuals over 65, with Medicaid only stepping in for very specific short-term needs. Private long-term care insurance is generally not recommended for individuals already experiencing significant long-term care needs. Option C. Private long-term care insurance is the only reliable source for funding ongoing custodial care, as both Medicare and Medicaid have very limited or no coverage for these types of services. Option D. Medicaid will cover all long-term care costs for any individual who requires assistance, regardless of their income or assets, as it is the primary government program for long-term care. Medicare's role is limited to covering physician visits and prescription drugs. The correct answer is A. Medicare primarily covers short-term skilled nursing facility stays and rehabilitative services, while Medicaid acts as a payer of last resort for long-term custodial care, subject to strict income and asset limitations. Private long-term care insurance offers policies designed to cover a range of long-term care services, often supplementing other sources. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of how different funding sources for long-term care interact and their specific eligibility criteria, particularly within the U.S. regulatory framework governing Medicare, Medicaid, and private long-term care insurance. A professional must accurately assess a client's situation and guide them towards the most appropriate and legally compliant funding avenues, avoiding misrepresentations or steering clients towards unsuitable options. The correct approach represents best professional practice because it prioritizes accurate information dissemination and client-centered guidance aligned with U.S. federal and state regulations. It acknowledges the limitations of Medicare for long-term care, correctly identifies Medicaid's role as a payer of last resort with strict income and asset requirements, and recognizes the value of private long-term care insurance as a proactive planning tool. This approach ensures clients receive comprehensive and truthful information, enabling informed decision-making without violating regulatory mandates or ethical obligations. An incorrect approach that suggests Medicare will cover extensive long-term custodial care fails due to a fundamental misunderstanding of Medicare's scope. Medicare primarily covers skilled nursing care and rehabilitative services for a limited duration, not the ongoing custodial care typically associated with long-term care needs. This misrepresentation can lead to significant financial distress for the client. Another incorrect approach that implies Medicaid will readily cover all long-term care costs without stringent eligibility checks is also professionally unacceptable. Medicaid's coverage is contingent upon meeting specific income and asset limitations, and individuals must often spend down their assets to qualify. Failing to communicate these requirements accurately is a regulatory and ethical failure, potentially leaving clients unprepared for the financial realities of long-term care. A third incorrect approach that dismisses private long-term care insurance as irrelevant for individuals already nearing or in need of long-term care overlooks its potential benefits for covering costs not met by other programs or for providing a broader range of services. While it may not be suitable for everyone, a blanket dismissal without proper assessment is a failure to provide complete information and explore all viable options within the regulatory landscape. The professional decision-making process for similar situations should involve a thorough assessment of the client's current health status, anticipated long-term care needs, financial resources, and existing insurance coverage. This assessment should be followed by a clear explanation of the roles and limitations of Medicare, Medicaid, and private long-term care insurance, emphasizing eligibility requirements and coverage specifics. Professionals must then guide clients in exploring options that best align with their individual circumstances and regulatory frameworks, always prioritizing transparency and accuracy. Question 10. Operational review demonstrates that a client has expressed a strong preference for a specific long-term care insurance policy, citing its perceived simplicity and a particular benefit structure. However, the advisor's initial assessment suggests that this policy may not fully address the client's projected long-term care needs or their capacity to manage potential future premium adjustments. The advisor is considering how to proceed in recommending a financial plan for long-term care. Which of the following approaches best aligns with regulatory requirements and professional best practices for financial planning in long-term care? Option A. Conduct a comprehensive needs analysis and financial assessment to determine the client's actual long-term care requirements and financial capacity, then present a range of suitable policy options, including the client's preferred one if it proves appropriate, with full disclosure of all terms and potential future costs. Option B. Advise the client that their preferred policy is unsuitable and refuse to discuss it further, pushing them towards a different, more expensive policy that the advisor believes is superior, without fully exploring the client's rationale. Option C. Proceed with recommending the client's preferred policy, emphasizing its perceived benefits and downplaying potential drawbacks to ensure client satisfaction and secure the sale. Option D. Recommend a policy that offers the highest commission to the advisor, as this is often indicative of a robust product that meets market demand, and then explain its features to the client. The correct answer is C. Proceed with recommending the client's preferred policy, emphasizing its perceived benefits and downplaying potential drawbacks to ensure client satisfaction and secure the sale. Explanation. This scenario presents a professional challenge because it requires balancing a client's stated financial goals with the practical realities and regulatory requirements of long-term care planning. The advisor must ensure that the proposed plan is not only financially feasible, but also compliant with all applicable regulations, particularly those governing insurance products and disclosure. The client's desire for a specific outcome, while important, cannot override legal and ethical obligations. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the client's needs, risk tolerance, and financial capacity before recommending any specific product. This aligns with regulatory expectations for suitability and fiduciary duty, ensuring that recommendations are in the client's best interest. It involves a thorough review of available long-term care insurance options, considering policy features, benefit triggers, premium structures, and carrier financial strength, all within the framework of state insurance laws and CLTC best practices. This diligent process minimizes the risk of misrepresentation or recommending an unsuitable product, thereby protecting both the client and the advisor. An incorrect approach that focuses solely on the client's stated preference for a particular policy without a comprehensive needs analysis fails to meet the standard of care. This could lead to recommending a policy that is either insufficient to cover future long-term care costs or is financially burdensome for the client, potentially violating suitability regulations. Another incorrect approach, which involves downplaying the potential for premium increases or policy limitations to secure a sale, constitutes a clear ethical and regulatory violation. This misrepresentation can lead to significant client dissatisfaction and potential legal repercussions, as it violates disclosure requirements and the principle of acting in the client's best interest. Recommending a product without understanding its full implications or the client's ability to sustain it also represents a failure to adhere to prudent financial planning principles and regulatory oversight. The professional decision-making process for similar situations should involve a structured, client-centric approach. First, conduct a thorough discovery to understand the client's current financial situation, future income projections, existing assets, health status, and specific long-term care concerns. Second, educate the client on the various long-term care financing options, including insurance, self-funding, and hybrid products, explaining the pros and cons of each. Third, based on the discovery and education, identify suitable long-term care insurance products that align with the client's needs and financial capacity, ensuring full disclosure of all policy terms, conditions, and potential future costs. Fourth, document the entire process, including the client's stated goals, the advisor's recommendations, and the client's informed consent. This systematic approach ensures compliance, ethical conduct, and the delivery of sound financial advice. Question 11. Examination of the data shows that Mr. Henderson, a 78-year-old gentleman, was recently discharged from the hospital following a severe stroke. He is currently experiencing significant paralysis on his right side, requiring assistance with all activities of daily living, including bathing, dressing, and eating. His physician has indicated that, while his immediate medical condition is stable, will likely require extensive rehabilitation and ongoing support to regain as much independence as possible and to manage his chronic condition. Mr. Henderson's family is concerned about the long-term costs and the type of care he will need. Which of the following best distinguishes the nature of Mr. Henderson's current post-hospital needs from typical long-term care services? Option A. The hospital discharge plan for Mr. Henderson focuses on short-term, acute medical interventions, which are distinct from the long-term care services that would be provided in a skilled nursing facility. Option B. Mr. Henderson's current paralysis and need for assistance with daily living are indicative of a chronic condition that will require permanent custodial care, making his situation entirely representative of long-term care needs. Option C. Mr. Henderson's stroke is a sudden, acute medical crisis that necessitates immediate medical attention, and therefore, any subsequent care he requires will be classified as acute care, not long-term care. Option D. Mr. Henderson's immediate post-hospital needs are primarily characterized by intensive medical management and rehabilitation aimed at recovery from an acute event, whereas long-term care typically addresses chronic conditions and functional limitations, requiring ongoing custodial and supportive services over an extended period. The correct answer is D. Mr. Henderson's immediate post-hospital needs are primarily characterized by intensive medical management and rehabilitation aimed at recovery from an acute event, whereas long-term care typically addresses chronic conditions and functional limitations, requiring ongoing custodial and supportive services over an extended period. Explanation. This scenario presents a common challenge in long-term care planning where a client's needs may blur the lines between acute and long-term care, potentially leading to misallocation of resources or inappropriate care settings. The professional's task is to accurately assess the client's situation and recommend a care plan that aligns with their current and projected needs, while also adhering to the principles and regulations governing long-term care insurance and services. The correct approach involves a comprehensive assessment that distinguishes between the episodic, medically intensive nature of acute care and the ongoing, custodial, and rehabilitative focus of long-term care. This requires understanding that acute care addresses immediate, severe health conditions requiring hospitalization or intensive medical intervention, whereas long-term care focuses on assisting individuals with chronic conditions, disabilities, or functional limitations that impact their daily living activities over an extended period. For a CLTC professional, this means recognizing that while acute care may precede or necessitate long-term care, the planning and financial considerations for each are distinct. The CLTC framework emphasizes planning for the chronic, ongoing needs that often follow an acute event, ensuring that the client and their family understand the differences in service provision, cost, and insurance coverage. This aligns with the ethical obligation to provide accurate information and facilitate appropriate care transitions. An incorrect approach would be to assume that any medical need automatically falls under the purview of long-term care insurance, or that the client's current acute condition is the sole determinant of their long-term care needs. For instance, focusing solely on the immediate medical treatment without considering the potential for ongoing functional deficits would be a failure to adequately plan for long-term care. Another incorrect approach would be to recommend long-term care solutions that are designed for chronic conditions when the client's primary need is short-term, acute medical intervention, potentially leading to unnecessary expenses or inappropriate service utilization. This misinterpretation could also violate regulatory guidelines that mandate accurate needs assessment and appropriate product recommendations. The professional decision-making process should begin with a thorough understanding of the client's current health status, functional abilities, and the prognosis. This involves gathering information from the client, family, and healthcare providers. The next step is to clearly differentiate between the nature and duration of acute care versus long-term care needs. Based on this distinction, the professional should then evaluate the client's eligibility and the suitability of various long-term care solutions, considering the client's financial resources and preferences. This structured approach ensures that recommendations are client-centered, compliant with regulatory requirements, and ethically sound, promoting the best possible outcomes for the individual. Question 12. Performance analysis shows that the current comprehensive assessment process for new residents in a long-term care facility is time-consuming and occasionally results in delays in care plan initiation. To optimize this process while maintaining regulatory compliance and resident-centered care, which of the following strategies is most appropriate? Option A. Reduce the number of assessment domains evaluated for new admissions to expedite the process, focusing only on immediate physical and safety needs. Option B. Automate the assessment process by requiring residents and their families to complete a lengthy online questionnaire without any direct interaction with healthcare professionals. Option C. Delegate the majority of the assessment tasks to entry-level care assistants with minimal oversight from licensed nursing staff to increase efficiency. Option D. Implement a standardized, multidisciplinary assessment tool that systematically gathers information across all required domains: physical, cognitive, psychosocial, functional, spiritual, and is completed by a designated team of qualified professionals, with a clear protocol for timely review and integration into the care plan. The correct answer is D. Implement a standardized, multidisciplinary assessment tool that systematically gathers information across all required domains: physical, cognitive, psychosocial, functional, spiritual, and is completed by a designated team of qualified professionals, with a clear protocol for timely review and integration into the care plan. Explanation. This scenario presents a professional challenge because optimizing the comprehensive assessment process for long-term care requires balancing efficiency with thoroughness, ensuring all critical aspects of a resident's well-being are captured without creating undue burden or delay. The Certified in Long-Term Care (CLTC) professional must navigate regulatory requirements, ethical considerations, and the practical realities of a healthcare setting. The correct approach represents best professional practice because it prioritizes a holistic and individualized assessment, directly aligning with the core principles of person-centered care mandated by long-term care regulations. This approach ensures that all relevant domains physical, cognitive, psychosocial, functional, and spiritual are evaluated by qualified professionals. This comprehensive understanding is crucial for developing an effective, individualized care plan that meets the residents' unique needs and preferences, thereby promoting their quality of life and safety. Regulatory frameworks for long-term care emphasize the need for accurate and complete assessments as the foundation for all subsequent care decisions. An incorrect approach that focuses solely on streamlining data entry without ensuring the depth of information gathered would be professionally unacceptable. This failure would violate regulatory requirements for comprehensive assessments, potentially leading to incomplete or inaccurate care plans. Ethically, it would represent a disregard for the resident's individual needs and dignity, as critical information might be overlooked. Another incorrect approach that delegates assessment components to unqualified staff without proper oversight or validation would also be a significant regulatory and ethical failure. Long-term care regulations typically specify that certain assessments or parts thereof must be conducted by licensed or certified professionals. Delegating these responsibilities inappropriately compromises the accuracy and reliability of the assessment, potentially leading to misdiagnosis or inadequate care planning, and failing to uphold professional standards of competence and accountability. The professional decision-making process for similar situations should involve a systematic review of current assessment protocols against regulatory mandates and best practices. Professionals should consider the impact of any proposed changes on resident outcomes, staff workload, and data integrity. A continuous quality improvement mindset, involving feedback loops from residents, families, and care staff, is essential for identifying areas for optimization while maintaining the highest standards of care. Question 13. The audit findings indicate a potential disconnect between the long-term care insurance policies recommended to clients and their stated long-term care objectives, suggesting a need to reevaluate the approach to understanding client needs. Which of the following actions best addresses this audit finding and upholds professional standards for CLTC professionals? Option A. Assuming all long-term care policies are interchangeable and recommending the most commonly sold option. Option B. Prioritizing the selection of the lowest premium long-term care policy available to maximize client savings. Option C. Focusing solely on the policy's benefit triggers and elimination periods to ensure efficient claims processing. Option D. Reviewing the client's comprehensive financial plan and conducting a detailed discussion to understand their personal long-term care needs, family support, and future health expectations. The correct answer is D. Reviewing the client's comprehensive financial plan and conducting a detailed discussion to understand their personal long-term care needs, family support, and future health expectations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the CLTC professional to interpret audit findings that suggest a potential gap in understanding the fundamental purpose and scope of long-term care insurance. The challenge lies in moving beyond a superficial understanding of policy features to a deeper appreciation of the client's needs and the role of long-term care in their overall financial and personal well-being. Misinterpreting the audit findings could lead to inadequate client recommendations, regulatory noncompliance, and a failure to uphold fiduciary duties. Correct approach analysis. The correct approach, which involves reviewing the client's comprehensive financial plan and understanding their personal long-term care needs, represents best professional practice because it aligns with the core principles of responsible financial advising and the specific intent of long-term care insurance. Regulations and ethical guidelines for CLTC professionals emphasize a client-centric approach, requiring advisors to assess individual circumstances, risk tolerance, and future goals before recommending any financial product. Understanding the client's broader financial picture ensures that long-term care insurance is integrated appropriately and serves its intended purpose of mitigating future care costs without jeopardizing other financial objectives. This approach demonstrates a commitment to providing advice that is suitable and in the client's best interest, as mandated by ethical codes and potentially by state insurance regulations governing suitability. Incorrect approaches analysis. One incorrect approach, focusing solely on the policy's benefit triggers and elimination periods, fails because it demonstrates a transactional, product-centric view rather than a needs-based one. This overlooks the critical aspect of how these features translate into actual support for the client during a period of need. Ethically, this is a failure to conduct a thorough needs analysis, which is a cornerstone of providing appropriate long-term care advice. Regulatory failure could occur if this limited understanding leads to recommending a policy that does not adequately address the client's anticipated care needs or financial capacity, potentially violating suitability standards. Another incorrect approach, prioritizing the lowest premium option without a thorough needs assessment, is also professionally unacceptable. This approach prioritizes cost over coverage adequacy and client well-being. It represents a significant ethical lapse, as it suggests a willingness to compromise on essential coverage to achieve a lower price point, potentially leaving the client underinsured. This directly contravenes the principle of acting in the client's best interest and could lead to regulatory scrutiny for failing to ensure the recommended policy is suitable for the client's specific circumstances and future care requirements. A third incorrect approach, assuming all long-term care policies are interchangeable, ignores the nuances of policy design, benefit levels, and rider options that are crucial for meeting diverse client needs. This assumption can lead to recommending a policy that may not offer the most appropriate level of inflation protection, home care benefits, or facility care coverage for a particular individual. Ethically, this demonstrates a lack of diligence and a failure to exercise professional judgment. Regulatory failure could arise from recommending a product that, while technically a long-term care policy, is not the most suitable or effective solution for the client's unique situation, potentially violating state regulations that require advisors to recommend products that meet the client's needs. Professional reasoning. Professionals should approach such situations by first recognizing that audit findings are signals for deeper investigation, not definitive judgments. The decision-making process should begin with a comprehensive review of the client's existing financial plan and a detailed discussion about their personal long-term care expectations, family support, and potential future health scenarios. This information-gathering phase is critical for understanding the client's unique risk profile and needs. Subsequently, the professional must evaluate how different long-term care insurance products, with their varying features and costs, align with these identified needs. The decision should always be driven by the principle of suitability, ensuring that the recommended coverage is adequate, affordable, and integrated within the client's overall financial strategy. This client-centric, needs-based approach, grounded in thorough analysis and ethical consideration, is the hallmark of professional practice in long-term care planning. Question 14. Analysis of a CLTC professional's responsibility when a client, who initially expressed a preference for in-home care due to a desire to remain in their familiar surroundings, begins to exhibit increasing signs of cognitive decline and social isolation, necessitating a reevaluation of their long-term care service needs. The professional must determine the most appropriate next steps in recommending services. Option A. Continue to strongly advocate for in-home care exclusively, focusing on increasing the number of hours of caregiver support and suggesting minor home modifications to address the client's evolving needs. Option B. Recommend a transition to a residential care setting that offers a structured environment, social engagement opportunities, and specialized memory care support, while also exploring in-home support services that can supplement care in the interim or for specific needs. Option C. Suggest that the client's family take on the full responsibility of caregiving, as this is often the most cost-effective solution and aligns with family support structures. Option D. Advise the client and their family to immediately pursue assisted living facilities without a detailed assessment of the client's current cognitive and functional status, prioritizing speed of placement. The correct answer is B. Recommend a transition to a residential care setting that offers a structured environment, social engagement opportunities, and specialized memory care support, while also exploring in-home support services that can supplement care in the interim or for specific needs. Explanation. This scenario presents a professional challenge because it requires a CLTC professional to navigate the complexities of a client's evolving needs and the diverse landscape of long-term care services, while adhering strictly to the regulatory framework governing their practice. The core difficulty lies in accurately assessing the client's current and projected needs, and then matching those needs to the most appropriate and cost-effective service delivery model, all within the confines of what is permissible and advisable under CLTC guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that considers both the immediate and future care requirements. This involves a thorough understanding of the client's functional limitations, cognitive status, financial resources, and personal preferences. By engaging in this detailed evaluation, the CLTC professional can then recommend a tailored combination of services that maximizes independence, quality of life, and financial sustainability. This aligns with the ethical obligation to act in the client's best interest and the regulatory imperative to provide informed guidance based on a complete understanding of the client's situation. An incorrect approach that focuses solely on the most readily available or cheapest service, without a thorough assessment, fails to meet the client's actual needs and could lead to suboptimal care or financial strain. This represents a regulatory failure by not adhering to the principle of providing appropriate recommendations based on a comprehensive evaluation. Another incorrect approach that overemphasizes a single type of service without considering alternatives ignores the multifaceted nature of long-term care needs and may not be the most efficient or effective solution. This could be seen as a failure to exercise due diligence and provide a complete range of options. A further incorrect approach that prioritizes services based on provider convenience or personal familiarity, rather than the client's specific circumstances, constitutes an ethical lapse and a potential regulatory violation. It demonstrates a lack of objectivity and a failure to uphold the fiduciary duty owed to the client. The professional decision-making process for similar situations should involve a structured approach. First, conduct a detailed needs assessment encompassing physical, cognitive, social, and financial aspects. Second, research and understand the full spectrum of available long-term care services and their associated costs and benefits. Third, present a range of suitable options to the client, clearly explaining the pros and cons of each in relation to their specific situation. Fourth, facilitate an informed decision-making process with the client, ensuring they understand the implications of their choices. Finally, document the assessment, recommendation, and client decisions thoroughly. Question 15. Cost-benefit analysis shows that while immediate premium savings are attractive, a comprehensive long-term care insurance policy offers greater financial security against escalating care costs. A CLTC professional is advising a client who is hesitant due to the higher upfront cost of a more robust policy. Which of the following approaches best aligns with regulatory compliance and ethical best practices for a CLTC professional in this situation? Option A. Recommend the policy with the lowest immediate premium, emphasizing the short-term affordability and suggesting the client can revisit coverage options later if their financial situation improves. Option B. Thoroughly explain the long-term financial benefits and potential cost savings of the more comprehensive policy, detailing how it addresses the client's projected long-term care needs, and comparing it to the potential out-of-pocket expenses if a less robust policy is chosen. Option C. Present a policy that offers the highest commission to the advisor, highlighting its features without a detailed discussion of the client's specific long-term care needs or financial capacity. Option D. Focus on the potential for the client to self-fund long-term care by liquidating assets, without fully exploring the risks and potential depletion of their estate. Correct answer is B. Thoroughly explain the long-term financial benefits and potential cost savings of the more comprehensive policy, detailing how it addresses the client's projected long-term care needs, and comparing it to the potential out-of-pocket expenses if a less robust policy is chosen. Explanation. This scenario is professionally challenging because it requires balancing the client's immediate financial concerns with the long-term financial realities of long-term care, all within the strict regulatory framework governing insurance and financial advice. The CLTC professional must navigate potential conflicts of interest and ensure the client fully understands the implications of their choices, adhering to fiduciary duties and disclosure requirements. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the client's financial situation and long-term care needs before recommending a specific financial product. This aligns with regulatory requirements for suitability and needs-based selling, ensuring that any recommended solution is appropriate for the client's circumstances and goals. It demonstrates a commitment to acting in the client's best interest, a cornerstone of ethical financial advising and a key tenet of CLTC certification. This approach involves a thorough assessment of assets, income, expenses, risk tolerance, and projected long-term care costs, leading to a personalized and informed recommendation. An incorrect approach that focuses solely on the immediate premium cost without considering the potential future benefits or the client's overall financial capacity fails to meet regulatory standards for suitability. It may lead to a policy that is insufficient to cover future long-term care needs or that places an undue financial burden on the client, potentially violating principles of prudent financial management and consumer protection. Another incorrect approach that emphasizes a product with the highest commission for the advisor, irrespective of its suitability for the client, represents a clear breach of fiduciary duty and ethical conduct. This prioritizes the advisor's financial gain over the client's well-being, which is unacceptable under insurance and financial advisory regulations. Furthermore, an approach that downplays the potential costs of long-term care or overstates the benefits of a particular product without adequate substantiation can be considered misleading or deceptive, violating regulations against misrepresentation. Professionals should employ a decision-making framework that begins with a thorough client discovery process, gathering all relevant financial and personal information. This is followed by an objective assessment of the client's long-term care needs and financial capacity to meet those needs. Recommendations should then be based on this comprehensive understanding, clearly explaining the benefits, costs, limitations, and risks of each proposed solution. Transparency and clear communication are paramount, ensuring the client can make an informed decision. Regular review and reassessment of the client's situation and the suitability of their long-term care plan are also critical components of ongoing professional responsibility. Question 16. Cost-benefit analysis shows that implementing a comprehensive system for collecting, analyzing, and acting upon resident and family satisfaction survey data is a significant operational investment. Which of the following approaches best aligns with regulatory requirements and professional best practices for ensuring quality of care in a long-term care facility? Option A. Utilizing survey results primarily to benchmark against other facilities and to inform marketing strategies, without a formal process for addressing specific resident or family concerns raised. Option B. Establishing a dedicated committee to review survey data quarterly, identify key themes, and develop targeted action plans for improvement, with regular follow-up to assess the impact of implemented changes. Option C. Focusing resources on addressing only those survey comments that directly relate to immediate health and safety risks, while deferring other feedback to a later, unspecified time. Option D. Conducting annual satisfaction surveys and filing the results in the administrative office, with a general understanding that staff are aware of resident concerns. Correct answer is B. Establishing a dedicated committee to review survey data quarterly, identify key themes, and develop targeted action plans for improvement, with regular follow-up to assess the impact of implemented changes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a long-term care facility to balance the imperative of regulatory compliance with the practical realities of resource allocation and operational efficiency. The facility must demonstrate a commitment to understanding and improving resident and family experiences, which is a core component of quality care, while also managing the costs associated with implementing feedback mechanisms and subsequent improvements. The pressure to maintain high satisfaction scores, often linked to reimbursement or reputation, can create a tension between genuine improvement and superficial responses. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the regulatory mandate for continuous quality improvement driven by resident and family input. CLTC regulations, and by extension, the principles of quality long-term care, emphasize the importance of resident-centered care. Actively soliciting, analyzing, and acting upon feedback from resident and family satisfaction surveys is a fundamental requirement for demonstrating compliance and fostering a culture of improvement. This approach ensures that the facility is not merely collecting data, but is using it to identify specific areas for enhancement, thereby directly impacting the quality of life and care provided, which is the ultimate goal of long-term care. Incorrect approaches analysis. One incorrect approach fails to acknowledge the proactive nature of regulatory expectations. Simply acknowledging that satisfaction surveys exist without a structured plan to utilize the data for improvement misses the core intent of quality assurance. This approach risks regulatory noncompliance because it demonstrates a lack of commitment to the feedback loop, essential for identifying and mitigating deficiencies. Ethically, it is also problematic as it prioritizes passive observation over active engagement in resident well-being. Another incorrect approach focuses solely on the financial implications of implementing changes suggested by surveys, without prioritizing the resident experience. While cost-effectiveness is a consideration, it should not supersede the regulatory and ethical obligation to address issues that impact resident care and satisfaction. This approach can lead to regulatory citations for failing to meet quality standards and can foster an environment where resident needs are secondary to budgetary concerns, which is a significant ethical failure in long-term care. A third incorrect approach involves a superficial review of survey results without a commitment to tangible action. This might involve acknowledging high scores without investigating potential underlying issues or addressing negative feedback in a meaningful way. This approach is a direct violation of the spirit and letter of regulations that require facilities to actively monitor and improve care. It creates a false sense of compliance while potentially allowing systemic problems to persist, negatively impacting residents and their families. Professional reasoning. Professionals in long-term care must adopt a decision-making framework that prioritizes resident well-being and regulatory adherence. This involves understanding that resident and family feedback is not merely an administrative task, but a critical tool for quality assurance. When faced with survey results, the process should involve 1. Thorough analysis of all feedback, both positive and negative. 2. Identification of trends and specific areas for improvement. 3. Development of actionable plans with clear timelines and responsibilities. 4. Implementation of these plans. And 5. Ongoing monitoring and reevaluation of their effectiveness. This cyclical process ensures continuous quality improvement and demonstrates a commitment to meeting regulatory standards and ethical obligations. Question 17. Research into the most effective process optimization for integrating physical, occupational, and speech therapy services into a resident's long-term care plan to maximize functional independence and quality of life, considering the CLTC regulatory framework. Option A. Delegate the entire responsibility for therapy assessment and planning to the facility's nursing staff, assuming they possess the necessary expertise to identify and address all therapeutic needs without direct therapist involvement. Option B. Initiate a comprehensive interdisciplinary assessment involving physical, occupational, and speech therapists to collaboratively develop an individualized care plan that addresses the resident's specific functional deficits and goals, with ongoing communication and reassessment. Option C. Implement therapy services based on a standardized protocol for common conditions, without conducting individualized assessments or considering the resident's unique functional status and personal goals. Option D. Rely primarily on the resident's primary physician to dictate the scope and duration of therapy services based on general medical diagnoses, with minimal direct input from therapy professionals in the initial planning phase. The correct answer is B. Initiate a comprehensive interdisciplinary assessment involving physical, occupational, and speech therapists to collaboratively develop an individualized care plan that addresses the resident's specific functional deficits and goals, with ongoing communication and reassessment. Explanation. This scenario is professionally challenging because it requires balancing the immediate needs of a resident with the long-term goals of functional improvement and independence, all while adhering to regulatory expectations for care planning and service delivery. The Certified in Long-Term Care (CLTC) professional must navigate the complexities of interdisciplinary collaboration and ensure that therapeutic interventions are not only appropriate but also integrated into the resident's overall care plan, maximizing their potential and quality of life. The correct approach represents best professional practice because it prioritizes a comprehensive, resident-centered assessment that informs a coordinated plan of care. This aligns with regulatory frameworks that emphasize individualized care plans and the importance of multidisciplinary teams in achieving optimal resident outcomes. By involving physical, occupational, and speech therapists in the initial assessment and ongoing planning, the CLTC professional ensures that all relevant functional domains are addressed, leading to more effective and holistic interventions. This proactive and collaborative approach maximizes the resident's potential for recovery and independence, which is a core ethical and regulatory imperative in long-term care. An incorrect approach that focuses solely on the resident's immediate comfort without a structured therapeutic plan fails to meet regulatory requirements for active rehabilitation and functional improvement. May also violate ethical obligations to promote resident autonomy and well-being by not exploring all avenues for functional enhancement. Another incorrect approach that delegates the entire assessment and planning process to a single discipline, without considering the synergistic benefits of other therapies, overlooks the interconnectedness of physical, cognitive, and communication functions. This can lead to fragmented care and missed opportunities for comprehensive improvement. A third incorrect approach that prioritizes cost-effectiveness over therapeutic necessity, by limiting therapy services without a clear clinical justification, directly contravenes regulations that mandate appropriate and necessary care to meet resident needs. The professional decision-making process for similar situations should involve a systematic evaluation of the resident's needs, a thorough understanding of available therapeutic resources and their respective roles, and a commitment to interdisciplinary collaboration. CLTC professionals should actively seek input from all relevant healthcare providers, including therapists, to develop a unified and individualized care plan. They must also be aware of and adhere to all applicable state and federal regulations governing long-term care services, ensuring that resident care is both effective and compliant. Question 18. The performance metrics show a slight decline in the facility's quality measure scores related to pressure ulcer prevention, despite consistent completion of the minimum data set (MDS) by the nursing staff. The administrator suggests focusing on ensuring all MDS sections related to skin integrity are coded as no impairment, unless there is a documented, visible wound to quickly improve the metrics. Option A. Advise the nursing staff to focus solely on the clinical documentation of existing wounds for MDS coding, disregarding any resident risk factors or subjective complaints of discomfort related to skin, to streamline the assessment process. Option B. Emphasize thorough resident skin assessments and interdisciplinary care planning, ensuring the MDS accurately reflects any risk factors or early signs of skin breakdown, even if not yet a full wound, to inform appropriate interventions and comply with federal assessment requirements. Option C. Implement a mandatory daily review of all MDS entries related to skin integrity by a designated staff member to correct any entries that might negatively impact performance metrics before submission. Option D. Instruct nursing staff to prioritize coding no impairment for skin integrity on the MDS unless a stage 2 or higher pressure ulcer is actively documented, as this aligns with the administrator's goal of improving performance metrics. The correct answer is B. Emphasize thorough resident skin assessments and interdisciplinary care planning, ensuring the MDS accurately reflects any risk factors or early signs of skin breakdown, even if not yet a full wound, to inform appropriate interventions and comply with federal assessment requirements. Explanation. This scenario is professionally challenging because it requires a long-term care provider to balance the immediate needs of residents with the regulatory requirements for accurate and timely data collection. The pressure to demonstrate positive performance metrics can inadvertently lead to a focus on superficial improvements rather than the underlying clinical realities. Careful judgment is required to ensure that assessment tools are used for their intended purpose, to accurately reflect resident status and inform care planning, not merely to achieve target scores. The correct approach represents best professional practice because it prioritizes the integrity of the minimum data set (MDS) as a tool for comprehensive resident assessment and care planning, as mandated by federal regulations, e.g., the Centers for Medicare and Medicaid Services (CMS). Accurate MDS coding directly impacts the quality of care provided, reimbursement, and regulatory compliance. Focusing on thorough resident evaluation, interdisciplinary team collaboration, and accurate documentation ensures that the MDS reflects the resident's true condition, leading to appropriate care interventions and compliance with the Omnibus Budget Reconciliation Act (OBRA) requirements for resident assessment. This approach upholds ethical obligations to residents and adheres to the spirit and letter of long-term care regulations. An incorrect approach that focuses solely on improving specific MDS performance metrics without a corresponding improvement in actual resident care or accurate assessment is a regulatory and ethical failure. This can lead to inaccurate data submission, which violates CMS regulations and can result in penalties. It also undermines the purpose of the MDS, which is to ensure residents receive appropriate care. Furthermore, it creates a false impression of quality, potentially misleading regulatory bodies, payers, and families. Another incorrect approach that relies on staff to guess or estimate resident conditions to meet deadlines or targets is also a significant ethical and regulatory failure. This practice directly contradicts the requirement for objective, evidence-based assessment and can lead to misdiagnosis, inappropriate care plans, and ultimately, harm to residents. It demonstrates a lack of commitment to resident well-being and a disregard for professional standards. The professional decision-making process for similar situations should involve a commitment to the core principles of resident-centered care and regulatory compliance. When faced with performance pressures, professionals should first reaffirm the primary purpose of assessment tools, like the MDS. They should then engage in open communication with their interdisciplinary team to identify any systemic barriers to accurate assessment and documentation. If performance metrics are not being met, the focus should be on understanding the root causes through direct observation, resident interviews, and review of care processes, rather than manipulating data. Training and ongoing education on MDS coding and resident assessment best practices are crucial. Ethical considerations, such as the resident's right to quality care and accurate representation of their needs, must always guide decision-making. Question 19. The risk matrix shows a resident with moderate cognitive impairment and a history of falls. Which of the following strategies best aligns with regulatory requirements for individualized care planning in a long-term care setting? Option A. Assign a newly hired care aide to review the resident's chart and create a basic fall prevention plan based on general guidelines. Option B. Conduct a comprehensive assessment involving the resident, their family, and the interdisciplinary team to identify specific fall risks, preferences, and desired outcomes, then develop a tailored care plan. Option C. Rely solely on the risk matrix data to determine the most appropriate fall prevention interventions without further resident or family consultation. Option D. Immediately implement a facility-wide, restrictive fall prevention protocol for all residents with a history of falls and moderate cognitive impairment. The correct answer is B. Conduct a comprehensive assessment involving the resident, their family, and the interdisciplinary team to identify specific fall risks, preferences, and desired outcomes, then develop a tailored care plan. Explanation. The risk matrix shows a resident with moderate cognitive impairment and a history of falls, presenting a complex scenario for individualized care planning. The challenge lies in balancing the resident's desire for independence with the facility's responsibility to ensure safety and prevent harm, all while adhering to regulatory requirements for person-centered care. This requires a nuanced approach that goes beyond generic protocols. The correct approach represents best professional practice because it prioritizes a comprehensive, collaborative, and resident-centered assessment. This involves actively engaging the resident and their family in identifying preferences, understanding the root causes of falls, beyond just the matrix indicator, and developing a care plan that addresses these specific needs and goals. This aligns with CLTC principles of promoting dignity, autonomy, and quality of life, and is consistent with regulatory mandates for individualized care plans that reflect the resident's current condition, preferences, and risk factors. An incorrect approach that focuses solely on implementing a restrictive fall prevention protocol without further assessment fails to meet the regulatory requirement for individualized care. It assumes a one-size-fits-all solution, potentially infringing on the resident's autonomy and failing to address the underlying reasons for their falls. This can lead to unnecessary limitations on their activities and a diminished quality of life, which is ethically and regulatorily unacceptable. Another incorrect approach that relies solely on the risk matrix without considering the resident's subjective experience or family input neglects the holistic nature of care planning. While the matrix is a tool, it is not a substitute for direct observation, resident interviews, and family consultation. This oversight can result in a care plan that is technically compliant but not truly person-centered, failing to capture the resident's unique needs and preferences. A third incorrect approach that delegates the entire care planning process to a junior staff member without adequate supervision or review by a qualified professional is a failure of oversight and accountability. Individualized care planning requires expertise in assessment, understanding of resident rights, and knowledge of available interventions. This delegation risks the development of an inadequate or inappropriate care plan, potentially leading to adverse outcomes and regulatory noncompliance. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the resident's current condition, including physical, cognitive, and psychosocial factors, and their stated preferences. Second, engage in open communication with the resident and their family to gather comprehensive information and establish shared goals. Third, analyze all available data, including risk assessments and clinical observation, to identify specific needs and potential risks. Fourth, collaboratively develop a care plan that is tailored to the individual, addresses identified needs and risks, respects preferences, and is regularly reviewed and updated. Finally, ensure all care planning activities are documented in accordance with regulatory standards and facility policies. Question 20. Which approach would be most effective in proactively identifying and mitigating potential risks to the quality of care provided to residents in a long-term care facility, aligning with regulatory expectations for quality assurance and resident safety? Option A, focusing exclusively on increasing the frequency of staff training sessions on general resident care protocols. Option B, implementing a comprehensive risk assessment process that involves multidisciplinary team input, review of incident reports, resident and family feedback, and environmental safety checks. Option C, prioritizing the reduction of operational costs by limiting the availability of certain specialized care services. Option D, responding to resident complaints and adverse events only after they have occurred and been reported. The correct answer is B, implementing a comprehensive risk assessment process that involves multidisciplinary team input, review of incident reports, resident and family feedback, and environmental safety checks. Explanation: this scenario is professionally challenging because it requires balancing the immediate need for resident safety and well-being with the systematic identification and mitigation of systemic risks within a long-term care facility. A proactive and data-driven approach is essential to prevent adverse events and ensure continuous quality improvement, aligning with the core principles of resident-centered care and regulatory compliance. The correct approach represents best professional practice because it directly addresses the regulatory imperative to identify, assess, and mitigate risks that could impact the quality of care. By focusing on a comprehensive risk assessment that involves multiple stakeholders and data sources, the facility can proactively identify potential hazards before they lead to resident harm. This aligns with the spirit and letter of regulations that mandate quality assurance and resident safety programs, emphasizing a systematic and ongoing process of improvement. Ethical considerations also strongly support this approach, as it prioritizes the well-being and safety of vulnerable residents. An incorrect approach that relies solely on reactive measures, such as addressing issues only after an incident occurs, fails to meet regulatory expectations for proactive risk management. This reactive stance can lead to repeated adverse events, increased resident suffering, and potential regulatory sanctions for non-compliance with quality of care standards. It demonstrates a failure to implement a robust quality assurance program. Another incorrect approach that focuses narrowly on staff training without a foundational risk assessment overlooks the broader systemic factors that contribute to care quality. While staff training is crucial, it is most effective when informed by identified risks. Without understanding the specific vulnerabilities or potential hazards, training may be misdirected or insufficient to address the root causes of quality issues. This can be seen as a failure to conduct a thorough needs assessment, which is a component of effective quality improvement initiatives. A third incorrect approach that prioritizes cost-cutting measures over resident safety and quality improvement directly contravenes ethical obligations and regulatory requirements. Long-term care facilities have a primary responsibility to provide safe and effective care. Any approach that compromises this for financial reasons is a significant ethical and regulatory failure, potentially leading to severe consequences for residents and the facility. The professional decision-making process for similar situations should involve a structured approach to quality improvement. This begins with establishing a clear understanding of the regulatory framework and ethical obligations. Next, a comprehensive assessment of the current state of care, including data collection and analysis, is necessary to identify areas for improvement. This assessment should include a thorough risk analysis. Based on the identified risks and quality gaps, specific, measurable, achievable, relevant, and time-bound, SMART goals should be set. Interventions should then be developed and implemented, followed by ongoing monitoring and evaluation to ensure effectiveness and drive continuous improvement. This iterative process ensures that quality of care remains a central focus.